But now we're joined by dentist Dr. Sam Jethwa, as we are opening up the phone lines to give you the chance to call the dentist. So whether you're experiencing tooth decay or sore gums, or you're constantly grinding your teeth at night, whatever your problem, do get in touch and put your question to dentist Dr. Sam Jethwa. The number is 0207 862 2222. Now, before we come to you, Sam, Jenny, I want to talk about your sore tooth that you had, because it looked really, really painful.
That's an understatement.
Okay.
The sore tooth that you had.
Sorry, I'm not doing it justice. Talk me through it.
I had a pretty bad experience with a root canal, which got infected. And for some reason, it got infected. It was quite dormant. I didn't really notice it.
Ooh,
There's the
you
picture.
are swollen,
So
yes.
you can obviously see which side of my mouth the infection took place. But it got that bad that the bone in my jaw actually got infected.
Wow.
And that was the one time where I said, just knock me out, please, and take me to hospital. I can't bear the pain anymore. And I was in hospital for a week on a drip. Yeah. And
how did that come about then?
What, the root canal?
Yeah.
Sam,
He did not go to the dentist.
Well, I'd obviously been for the root canal, but it was just unfortunate. I mean, I wouldn't like to say. I mean, I'm obviously not with that dentist anymore because, well, actually, I wasn't with a dentist for a very long time, and I had a huge gap, like literally 2 teeth missing here, for at least 7 or 8 years, and it's taken me this long to actually get teeth put in. So I had a terrible experience. But it's all fine now.
OK. And are you going to the dentist regularly now?
Well, see, my problem was a little bit, if it ain't broke, don't fix it.
Ah.
A little bit like that.
I'm sure, Sam, you've got something to say about that.
Well, you see, that prevention is what it's all about, isn't it? So
don't look at me like that. If you look over his glasses like that.
If we had spotted that, I wasn't your dentist at the time, but if that was spotted early, if you were there to have it spotted, then maybe something could have been done about it. But sometimes things get left and we don't know something's wrong. So then it gets to that desperate stage. OK, yeah. Let's
sort of just step back a bit and look at the wider dental crisis that is being taking place. I mean, it's just been hitting the headlines again and again over the past recent weeks. Now, the government have just shared some new plans on this. Can you talk me through what's their latest update on how to solve the dentist crisis?
Yeah, so I think it's not an unknown fact that we have an issue in this country with access to NHS dentistry.
And we're looking at pictures here. This is people queuing in Bristol because a NHS dentist opened up. Yeah. I mean, they were queuing for days.
Yeah, the police had to get involved to actually hold people back, so it was a desperate situation. Which is sad to see that we in this country are having people queuing up to get access to dental care. It's been ongoing for years and years. It's not just this government. It's been an ongoing thing of supply and demand. We have NHS dentists who are retiring, and we have new dentists coming in. Not quite enough spaces to actually go into NHS dental practices. Numbers of patients requiring treatment going up. So it's just an ongoing issue. And the recovery plan does set out some pretty decent initiatives, but they do just look like initiatives. We don't have the detail. There's no meat on the bones yet on that. So it's really hard to know whether any of it will work. Some of the ideas are suggesting taking vans to rural areas with dentists and doing dentistry in a sort of like a mobile unit, which who's going to staff that? Who's paying for that? Where these unanswered questions are what we really need to know.
OK. Well, we have had lots of messages coming in already. Stephen has sent in this question. He is based in Bristol. I've lost all my teeth to serious gum disease. I can't get a dentist to sort out my mouth for dentures or to get teeth implants. I'm finding it hard to eat foods that I love. I'm on universal credit and nearly at retirement age. What options are there for me? Sam?
This is obviously a very sad situation because he can't enjoy food, quality of life reduces, and he's coming to an age of retirement. So it gets even harder to afford to do things that can be more expensive to treat. So if we had we rewind a certain number of years, again, it comes back to the conversation on prevention. Prevention is really going to be better than cure. If we spot these sort of gum disease issues early, we can go in and see hygienists. Hygiene therapists are a massively underutilised area within NHS dentistry. They can do children's dentistry, they can do certain routine treatments, and if they can be utilised some way in the system, which hasn't quite been laid out yet, clearly, then actually we might be able to solve some problems like Stephen's earlier.
But what does Stephen do? Does he
Yeah,
end
what
up
does
in
he
A&E
do?
or
I know,
what does
well,
he do?
maybe
I mean,
that's-
and then
Stephen's
it's-
issue now is quality of life. He doesn't have teeth to enjoy food, and that's going to become a problem for him because that will then lead to other health issues, gut issues.
And mental health issues
Yeah,
as well. You know,
it will.
it really affects sort of the way you feel about yourself and pain levels and all that stuff.
It's very sad, and Stephen's not alone. There's many people just like Stephen who can't get in to see a dentist, and the situation's got so bad that they feel like they're desperate. So access and prevention, combination of these things, could eventually solve the problem and stop people doing DIY dentistry. We're hearing about that.
Yes.
Going abroad and doing treatments, which might be done to a standard that gets done in a week, and that would take us 6 months to do properly. So eventually that causes problems as well. So that's the answer, really.
James, you have a question for
Apparently
Sam,
I do.
don't you?
So
I
I'm
was
slightly
very freaked out by
not
this.
that I'm self-conscious here, but I'm surrounded by 3 people with perfect teeth. I mean, look at you all smiling away with your perfect
Not
gnashers.
necessarily our own, though. That's the thing.
Yeah, well,
Some have been
Yours are your own.
enhanced.
So, I've got what I would like to think is a reasonably good set of teeth, and they've always been well looked after, and I've never had any fillings, and all of this sort of great stuff. They're not perhaps as white as I would like, and there are gaps. The reason there are gaps is that I've got 2 baby teeth. Now, I think you may have a cheeky picture that I was, pinned against the wall. There I am, pinned against the wall. I mean,
I've never heard of this.
So-
I thought they'd be like tiny, weeny
no,
little.
so,
Let me see.
They are small, though.
Well, oh, they're cute.
And the
But they're cute.
Anyway, so there you are. That's cute. Now, the dentist back when I was in my teens said, your baby teeth haven't fallen out. They'll be out by the time you're 30. Well, either I've aged really
And you're-
badly, or
you're just
alternatively,
30.
I'm 53. And they still haven't
So
fallen
it's
out. And
only
every
gonna
time I
be
go to the
a year.
dentist, we look at them and should one take the view? Obviously, oral hygiene, making sure that your teeth are in good shape and form and having them checked up and brushing and all these things, very important. Does it matter if, one, should they be perfectly white unless you're on the telly? Oh, I'm on the telly. Or secondly, things like gaps, do they matter? I mean, if there's nothing wrong with them, am I better to just leave them be or intervene? What would you advise?
It's up to you. Really.
It's a very good, you're right, it is up to you, but it's a very good question because I think what you're battling with, really, is do I do something about it, but I'm not willing to compromise the health of my teeth in order to do it?
Yes.
So if you can find a solution and find a dentist that provides minimally invasive cosmetic dentistry, and you can afford to do that, well, that's a great thing because that will improve your possibly not yourself because you're quite happy with your teeth, but some people do get quite down and affects their mental health about how they appear because of their
I'd like them
smile.
to be whiter, but I mean,
So-
they have the signs of having drunk a few coffees.
But it,
Over the
Glass of red wine
the
here and
answer
there.
really is that balance between minimally invasive treatments. So there are many things. Composite bonding is something that people do, which is adding
Well,
material to
do you
teeth.
wanna look at mine? I looked at yours. So that's composite bonding.
Let me just get the glasses
so
out.
so they're still my own teeth.
Yes.
But then there's bonding on top.
Oh, does that?
My
how does
teeth
it,
are naturally very dark and grey at the top.
Right.
So the composite bonding there. Yeah.
and how does that work when it comes to like
whiteness.
eating apples?
Well, the funny thing is, doing radio, as you well know, of course, it means my teeth are a lot thicker.
Oh.
So I really struggled staying. I can't see.
Go on.
Bruce Springsteen. For
'Cause
about a year after having my composite, so I had to call him the boss.
You see, because that wouldn't be a problem for me, because I do speech-based radio, so Bruce Springsteen rarely comes up in conversation. So maybe I'm okay, maybe I'll just go with it.
There are other alternatives. So something I do a lot of is ultra-thin porcelain veneers. Those can be done minimally invasively.
That sounds expensive.
Keeping them thin, and they can be
Is this for more
highly
cosmetic
attractive.
reasons, or could this be for other reasons?
There is a group of patients that we'll see that are coming for purely cosmetic reasons because they want to feel better about themselves through their smile because there's something that's affected them. But often there is a functional or a health element that's led the patient to a state where actually they now have a cosmetic concern, but it's because of, like you said, people grinding their teeth, or they've had previous fillings, they've had composites in the past, they've had other treatments that actually now need to be changed and upgraded, or their teeth have become damaged.
So something like a veneer, if
Yeah.
you have that done, so presumably if your teeth are healthy, then it is just that, a veneer. It goes on top, and purely cosmetic.
Cosmetic, but that has to be done from a functional point of view as well. So we have to think about long term, what will you do in 10, 15 years? We have to make sure your teeth are still intact. Everything, if minimally invasive cosmetic dentistry is a great thing for people who, if you can afford to do it, because you're not taking risks. We are seeing a lot of dental tourism I know we talked about this sort of thing before, people going off and having cosmetic treatment done, but extremely invasively. That's not recommended. We don't recommend that. But if you can find ways of doing things that improve things healthily and safely,
then
next time
go
you're on the
ahead.
show,
Yeah, no,
I'll
be off now.
Yeah.
We'll talk about it after the show.
Okay, let's find out what you guys think at home. Linda from Kent, have you got a story for us?
Yeah, I have. I worked in dentistry.
Okay.
All the time I was at work.
As a dentist?
Sorry?
As a dentist?
No, as a nurse.
Okay.
And I feel that a lot of the people that are not being able to get hold of a dentist are kind of like they're their own worst enemy because a lot of them are not looking after their teeth.
Yeah, no, you make a good point, Linda. I think, do you think this has got anything to do with the rise of tooth decay in children? Are we not brushing our teeth as kids?
I don't think people at school. I think they could play a big part.
Okay.
By kind of maybe when I was young, we used to have milk. It was awful. It was cold in the winter and off in the summer.
Yeah.
But if they had something like that in schools where they did a communal toothbrushing, that would help a lot.
Yeah.
And also the obvious is what the kids are eating, you know.
I know.
Yeah.
My youngest, she's 15. She must be one of the only kids in her class who's only got one filling. I mean, that's
good.
That's like a miracle.
Yeah.
That is because
that
she
strict
didn't have a
parenting?
lot. Well, it was just not having a sweetie drawer.
Oh.
That's
My
what it
daughter
was.
hates her teeth being brushed. I literally have to
Right.
prise her mouth open, pin her down. You know, it sounds like I'm sort of performing some awful operation on her every
But I think
evening,
we've got to take some accountability, haven't we, as parents, with our children, about educating them as well,
Yeah.
and educating parents about, you know, diet.
Have you got any advice for parents
Yes,
about around diet
I have a
and
6-month-old at home.
Okay.
And so
The one tooth.
Yeah, not quite getting to teeth yet, but we are trying to introduce her to being familiar with a toothbrush in her mouth. She's got a little baby toothbrush and she just plays with it and it's part of the bedtime routine. So we're trying those things because hopefully then that won't make her kind of not want it afterwards. But Linda, firstly, thank you for your years of service as a dental nurse. We can't do the dentistry without you, so thank you very much. But you raise a good point. I think it's about prevention again, isn't it? If the government has laid out this new plan, and in that plan it does involve going to schools, and I think it's Smile for Life is the campaign, to go into school and actually teach kids how to brush and about diet. So I noticed we're looking at nurseries and things for my 6-month-old because you have to plan in advance, and we went in and had a tour and they were all eating raisins at snack time, which for me as a dentist was quite shocking. I thought that would be something. Yeah,
so raisins are healthy, no?
Well, this is exactly the point.
Well, you don't give them to dogs. I mean, they won't have it. I mean, because it's not just because of the teeth, but it's also because of the sugar.
And then, so this high
because
sugar,
you're not
very sticky,
but
it's
you're
fruit,
not brushing the dog's teeth. No, it's terrible.
And because it's fruit, we think that actually that's healthy. But when you have a dried fruit like that, it's actually as bad as a sweet. In fact, worse because it's sticky to the teeth. So it was shocking to me that these things are still happening in that sort of nursery or school environment. So there is a lot still to be done in terms of education.
Didn't even get to lunchtime on the turkey Twizzlers.
And also it's things like drinks, you know, juices.
Yes.
I think the beakers, you know, when children are, and they're sucking through the sort of like really sugary juices, acidic juices and straws and all those things. It's really just
those sorts of drinks used to be a special treat, and they're every day now. And then the other thing is that fruit juice, you know, lovely as it is, for all its maybe health benefits, who knows? But if you're drinking it as regularly, you're taking out the fibre, you're taking out the eating process of the chewing and the thing like that, and it's concentrated sugar.
Absolutely.
And you
Let's
sip it over a period of time, which is much
So you
worse
would say
for the teeth.
it's when you're doing it's more the time that it's taking. You know, if you're nibbling all the time on a raisin every minute or whatever, instead of just having it in one go, you know,
makes a difference. Let's hear from Kamal in Derbyshire. Hi, Kamal. Have you got a question for Sam?
It is Kamal. Thank you very much. I've got a question for Dr. Sam.
Yeah.
And I'm nearly 54 years old, and I've been to dentist once in my lifetime. And between my age of 35 and 37, I used to get toothache on my wisdom gum, and that's infected so badly And I used to take that without any prescription. I take the paracetamol, any kind of painkiller. I used to go away every couple of weeks. Then I was forced by my ex-wife, my wife, say, you need to go and see a dentist. So I went to see a dentist, and then they said, yes, I don't have enough space to get the tooth to grow. And I'm going to give you some antibiotic, and once it's gone and come back, we're going to get that tooth off. So anyway, I took that prescription, I went back after a couple of weeks. As I lay down, she said, I'm going to give you a couple of injections. As I pull it out, you won't feel any pain, but you will feel the pressure. I swear to God, that scared me so much. And
Is this why everybody wants the dentist?
I just walked out. I just walked out with the excuse. I need to go and pick up my kids from the school.
You didn't have the teeth out, or you did?
And she did say, Kamal, you're making a mistake. It's going to come back again. And touch wood, it's never come back.
So, Kamal, would you say you're scared of the dentist if you've only ever been once?
Yes, I'm scared because the way the dentist said, you won't feel any pain, but you will feel the pressure. And that give me a bump in my heartbeat.
I think Sam's feeling the pressure now, aren't you?
Sam, do you have advice for people who are scared of the dentist? Because, I mean, we all are a little bit, aren't we? It's never that pleasant.
I'm a very weird person. I loved going.
Yes, you are a dentist,
and then I thought, I want to be here the rest of my life, so now I am every day. But I think it is something we don't ignore. In my clinic, we really do pay a lot of attention to nervous patients, and we spend a lot of time, and it's about building trust. So often there's a bad experience, and often it's the school dentist or something as a child that just sticks with you. And I think it's, if you can open your mind up to trusting the dentist again, we see a lot of people who actually are afraid of being judged. They feel like they've left things so long that when they come into the practice, they don't want to be criticised for that. They've now decided to make a change and find time to come in, etc. But they feel that they're going to be judged for that, which is a shame. And, you know, dentists, we're not there to do that. We're there to help.
It's so true.
That's the message.